So with that, I'm going to go over to English. And Vanessa, if you can give us an idea about COVID case, hospitalization, and vaccine numbers in the state of Colorado as it stands right now, please.
Sure, Chris. Up to date, we have 307 new cases reported, 28 new deaths among cases reported, 77 persons hospitalized, and 60% of those are not vaccinated. 11 new hospital admissions, and the 7-day moving average positivity that I have shared before here in these segments is 4.63%. This is slight higher than previous weeks. And among the Hispanic community, the vaccination rate has moved very slowly, but it has moved. And right now is 39.83% for those who report rate and ethnicity, but we know that there are some people that they don't report their race and ethnicity. So there is like a model that we follow in order to estimate how many people from the Hispanic community are vaccinated, and that number is 47.95%.
Okay, well, good to hear about the slight increase, although I know it is slow in the Hispanic community in terms of those vaccination numbers. Doctor, I want to go over to you. And of course, the big news that came out this week was the removal of the mask mandate on airplanes that came from the federal judge, struck it down. Doctor, in your opinion, should people continue to wear masks on airplanes?
Thank you for that question, Chris. And I believe that people should be using a little bit more of a common sense. As Vanessa was saying right now, the numbers of positive tests, the rate of positive tests is increasing here in the state of Colorado. And as she was also mentioning, at least 1 out of 2 people in the Hispanic community isn't vaccinated. So just as common sense, wherever we go, half of the people are not going to be vaccinated. If there are people we don't know, it's better to be protected and not to take a virus to our home. So I will wear a mask. The problem with just using these, following mandates only, instead of following common sense, is more political than real. So I would just urge the people to keep using their common sense in this. Use your mask whenever you're in places where you're enclosed with people you don't know.
Doctor, what are other big public locations where you would recommend that people continue to wear masks, in your opinion?
Anywhere where you're going to sit in a closed area with people you don't know. And I would say, for example, the DMV, you're going to get a driver's license, you're going to sit there for a couple of hours or maybe for an hour while you're waiting. I would rather wear a mask than not. If you're going to a shopping center and there's a lot of people, I would wear a mask there. I think it's better to be protected now that their cases are rising.
Doctor, finally, can you tell us about the vaccine clinics that Servicios de la Raza, I know, with some work with the Mexican consulate, that you're organizing for tonight and this week, please?
Yeah, we're working every day with the Mexican consulate and Servicios de la Raza to have these clinics on Tuesdays. These are open spaces for people who want to get their first shot or their second shot or their boosters to come. There's a phone number they can call to get an appointment at Servicios de la Raza, but they can just walk in and we're here waiting for them.
Great to hear, and thank you for both of your work in helping inform us here about the COVID-19 pandemic here, specifically in the Hispanic community here in the state of Colorado. Again, once more, just give Servicios de la Raza a call about those vaccine clinics. And if you have a question, either English or in Spanish for our guest today, again, please email me at chris.bianchi@9news.com, and we'll make sure it is answered. Again, that question can be in either English or in Spanish, but that'll do it for this week's look at COVID-19 in the Hispanic community. Dr. Ricardo González-Fisher, Vanessa Bernal, thank you both so much for joining us here today.
Thank you.
Thank you very much.
We'll see you again next week. Thanks again.